finally, it's like working now. It wasn't working before. Um, I don't know. I don't know what's going on. I'm trying to see if I can. This is my first time like going live. Uh oh. Yes, I think. I don't know. I don't know what just happened. Oh, oh, okay. We're back. All right. Hi, everybody. I know that there's like not people in here yet. This is like my first time ever going live on YouTube, and um, I thought about this on and off again in regards to the surgery and how I wanted to discuss it. I even made a video, but I kind of scrapped it because I felt like it was a little bit all over the place. And I know that some people come for the straight up facts, they don't want any of the bullshit. Yes, this is going to be uncensored, so you guys will not hear the doorbell noise. um, but a lot of people have been asking me about my journey with endometriosis and how I came to find out that I actually had it, um, as well as like other things that came about like during the surgery. So please forgive me if I do look down every now and then. I do have some like notes and things written out for you guys just so I could stay on track with this. And then there'll also be a time to where I like answer your questions as well. So just bear with me because there's going to be quite a bit of talking here. So I'm just going to dive right into it. So over the years, many years, and I'm not trying to make this a 4 score and 7 years ago type of conversation, but um, I've been in and out of gynecological offices, and they've pretty much like, as much as I loved my previous doctor, like I felt like over the years, like the service kind of started to decline, which I mean, with the pandemic, we started to see like a lot of businesses start to decline because they forgot the customer service aspect, etc. But that's a story for another day. Um, my doctor, I just kept having these pains. I'm like, what the heck is going on here? Like something's not right. It was outside of like my period pain that I would usually get like, come that time of the month. And I my doctor always seemed to be unavailable. I would pre-schedule these appointments like 2 3 weeks in advance, and she just the day of my appointment always got blown off, always. Like, and I definitely understand, like, certain gynecologists, they have to like, go out and about, not certain but all, when their patient is having a baby. But like once you start hearing about it over and over and over again, and it's always on the day of your appointment, I feel like that's kind of like making an excuse, like you don't want to see somebody or something like that, because it got too frequent. And my sister was like, okay, you need to see a different doctor. So scheduled a different doctor, went in, and while like he was super nice, he kept asking me what I wanted to do about the situation. And I said, I have no idea, because I had found out from the hospital at the time, because we thought it was appendicitis. It we thought for sure it was appendicitis because I did a call in just to see like if it was really worth it to go into the hospital. And they said, to be better safe than sorry, you might want to go in. And my dad, he had a ruptured appendix at one point, and that was super scary. We don't want to have to go through that. Um, so went in, and I was like laying on the table while she was like doing the ultrasound. She did an internal and an outside ultrasound, and immediately like I saw the screen. Like honestly, you shouldn't have the screen very close to the patient like that if you really don't want them seeing anything. And then on top of all of that, the worst part is that ultrasound techs, they cannot tell you what's on there, or they can't answer your questions because they have to have the doctor legally discuss that with you, because they can't make the final say on certain things, which I definitely understand. But at the same time, like, that makes you want to ask, because you're like, something's not right here. And in my heart just, I just remember my heart just pounding like out of my chest. And I recognized that something was not right on that ultrasound. I was like, and I was a perfectly normal person before I had went into that room. And when I came out, like my mom just saw my face just, it was just, I was in tears because I was like, something's wrong. Like I'm immediately going to the worst possible thing. Um, but yeah, they told me that I had a hydrossalpinx. It was probably the result of an infection that I had that was not taken care of fully or well, um, which was very odd because every time I go into doctor's offices and things of that nature, they always told me like I either had just like a regular bacterial infection, nothing odd, no, no like polyps, no STD, nothing like that. There was literally nothing. So to hear that, you're just like, what's going on? So technically, what a hydrossalpinx is that your um, tube, like your fallopian tube, it swells up with water or fluid, and it's kind of trapped. And what happens is that because of all of that water and stuff, like it literally almost closes the tube, if not immediately closes the tube. And what it would have to take is surgery to either remove it, depending on the doctor's discretion, like if they would want to remove it or if they just want to cut that piece and try and like fuse the two together, because I've heard bouts of that happening. um but it can definitely like cause infertility. It can cause like issues um relating to that, as well as like pain, because like during your period it kind of like gets a little bit bigger and bigger because more fluid is building up. So you can only imagine what type of pain I'm usually in during my period. um so uh that was that. I didn't think of anything else. So now I'm in the doctor's office. He's asking me what I want to do, and I'm like, I've never been in this situation before. So like, what should I do? And he said that we should monitor it like over time. Something with me just didn't sit right with that. And my sister said no. She's like, let's go see my doctor, which I'm very glad, and very I'm very thankful to have my sister and blessed to have my sister, because like she literally was like, no, cut the bullshit. We're going to go see my doctor. This is how it's gonna go. And yeah, like that, I'm just so happy that I have a doctor like her in my life. Like seriously. Cuz she literally, I told her what was going on. I did not feel rushed. And some doctors, you get that aura of you're bothering them. I didn't feel like I was bothering her. She listened to everything that I had a concern about. Um where the pain was. She was very very thorough. So that day she did a pelvic exam, and then she told me, I want you to come back, because before I even decide on surgery or anything, she was like, I want to take a look around first. I'm like, okay, that's cool, that's fine with me. When I tell you, when I came back and I had my ultrasound surgery, or not surgery, sorry, my ultrasound, it was an outside one. It was an internal one. And the problem with internal ultrasounds, and or excuse me, the ultrasound in general, is that you have to drink a lot of water, so you feel like you gotta pee. So it's kind of uncomfortable. But this one was particularly very uncomfortable. I've never had a uncomfortable ultrasound like that. And the lady was so sweet. She was just apologizing. She was saying like, I'm so sorry for hurting you. I literally closed my eyes and I wanted it to be over. Like, I was trying to be very very calm. I was trying not to like say ouch 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 or whatever or anything. Like, it hurt. It genuinely hurt. I've never felt like that ever. And then I waited in the waiting room. They called me back, and Dr. Jones came in. That's my doctor. Um, she came in and she sat on the stool, and then you're like, oh crap, not the stool, not the stool. What the heck? Um, I'm sorry if anybody's commenting. I can't see. Okay. I don't know what I just did, but yeah, she sat on a stool. She rolled up next to me. Y'all know when a doctor rolls up on the stool, there's something wrong. So I'm saying, I'm like, not the stool, damn it. She shows me the picture. She goes and says, now we see what's going on with the right ovary. That's the one that has the hydroxyl pinks and all that stuff. And she's like, and you got some cysts over there as well. She said, the problem that I'm having understanding is why your left side is trying to do the same thing. And I said, what? She was like, yes, your left side is trying to do what the right side is doing. You just don't have a hydroxyl pinks on this side, but you have like a lot of cysts happening and stuff over here. And she was like, just from this alone, she's like, you're in a lot of pain right now. And I said, yes, I'm aware. And she's like, that's a lot of pain. She's like, I want to get you out of pain first. That's my biggest priority. And then I want to see what's going on. So she said, I want to schedule a laparoscopy, or laparoscopy. I don't know if I'm saying that correctly, incorrectly. My mom will probably correct me later. Um, but it's technically like where they make three little incisions. So they have like, I have two on my bikini line, and then there was one in my belly button. And they take a camera essentially and they go in there and they see what's going on, and they can extract anything that they need to. They can move things around if they need to and stuff. But there are certain risks with the surgery, with like poking things and prodding and all that stuff like that. So she said she wanted to do that. I did start crying and I told her, like, I was like, you know, like, because she was like, are you concerned about, and I really like that she was trying to get in my head, because like a lot of doctors don't really like sit with you and be like this. She grabbed both of my hands and she said, it's okay. She was like, we're going to get you out of pain. She was like, and we're going to figure it out. It's going to be fine. And she was like, so what are you thinking? She's like, are you scared about the procedure? Are you nervous about anything? And immediately my mind just went to kids. And I'm not gonna cry. I'm not gonna cry. But I said, even though I don't want to have children at the moment, like I'm about to be 30 and I want it to happen in the future, am I going to be able to have babies? Like, and she said, we're not ruling that out. She was like, we will determine that later on, but she said this is the first thing that we have to do. We have to get this out of the way. So then I had to schedule the surgery. I had to talk to the people at my job. Um, and that's another topic, because like a lot of us women that are going through endometriosis, we have a hard time discussing it within the workplace, because we automatically think that somebody's going to think that we're not capable of our job or we can't do our job or anything like that. And the one thing I can say is that my boss pretty much said, like, nobody thinks that you have to get better. You got to take care of you before like you do anything else, which is very true. It's something that I needed to hear, because like I'm consistently putting myself, or excuse me, I'm putting other people before myself, or other things before myself. And I'm coming into an era of my life to where I'm learning that you got to take care of you. Otherwise, you're not going to be able to take care of anybody else. So I did need to hear that. I think it was genuine. I really hope it was genuine. I'm not questioning that. But like in that moment, she did say the thing that I did need to hear. And she's like, you got to do what you got to do. And that's hard. Like, that's really hard, dealing with your own mental thoughts and thinking like, you know, like, I think that somebody's going to think I'm incapable of doing something because of the medical issue that I'm having or that I'm going through at the moment. And just know that y'all are not alone, because I literally struggled with that for weeks, especially like with somebody that is I am a working woman. That is what I identify as. I identify as a woman. And I work really, really hard. And for other people in my head to think that I'm lazy or I can't do certain things because of my mental, or my mental, not my mental, but like, I mean, that is a part of it, but my medical ailment, um, it's hard, and it's mentally, um, deteriorating. It causes you to go into a downward spiral of like, not just like people pleasing, but like it's just like you just feel like you're not enough in a way. I think that's the best way that I can describe it. But most of you guys will get what I'm saying. Um, so I went through all of that. I had to go through like the FMLA process, the short term disability process, because like I wasn't gonna be on my feet or anything like that. Um, that's like a whole big thing. So like every employer has a different way of like handling like surgical things. So definitely get with your employer if you do, have to have a surgery, and usually your HR or the people that are in that department, they can guide you through that. Um, then I had to prep for the surgery because a week before surgery, you're not allowed to take certain medication. All I was doing at the time was taking a multivitamin. I couldn't even take that. Um, the night before surgery, you can't eat anything at 12 o'clock in the morning, and then you can't drink anything at 12 o'clock in the morning. So literally the night before, I was pigging out. It was bad. Like I literally had I can't even tell you, like I literally had like cinnamon rolls. I was like binging because I'm like, I'm not gonna be able to eat this stuff for a while. It's gonna be so bad. It's gonna be so disgusting. So had so much water. I was literally dousing myself with water, I think around like 11 o'clock, because like, I don't know about you guys. I eat like crazy. Like I like food. I like to eat. When I eat, I like to eat. So in order to keep me full, I literally drank like almost like a gallon of water that night. So I was like up and down in the bathroom all night. That's probably TMI, but this is a TMI type of talk, so it's fine. Um, but yeah, so I just want to go over some things that I bought, like just in case if you are having a laparoscopy, you know what to expect, kind of. And this is a not just a like before I had the surgery type of buy. I added the things that I should have bought as well. So I'm just gonna look at my list. So I had, before surgery, I went to the store and I got soup. I got like a crap ton of cans of soup because I heard that because they're going to be messing around with everything, like, and you're going to have these incisions in your belly, like your bikini line, and then like in your belly button. You're not going to want to move very much, and also you're not going to want to strain yourself when you have to go to the bathroom. When you buy food before a surgery, such as a laparoscopy for possible endometriosis, you really want to think about the aftermath. You have to think about it, and I'm just going to talk about it. Like, everybody poops. Let's get it out the way. It's not even like an uncomfortable discussion. Everybody poops. Your favorite actors poop. Your favorite singers poop. Everybody poops. Okay, it's a lot of poop. And then when you're dealing with endometriosis, periods, anything like that, all of that is connected. So you have to think about what you're putting into your body is what's going to come out. And whatever you put into your body is going to depend on how difficult it comes out. So like if you're eating soups, like light soups, like not like cream based or anything, I literally got vegetable soups, like ones made with water, um, ones made with like pureed veggies, things of that nature, like not cream, no dairy at all. You don't want to put dairy in your body, like, before or after your surgery. Um, I say get vegetables, but stay away from starch, because you have to think about it like this. If you have like a lot of fibrous veggies, like let's just say like you eat like a lot of like broccoli, or a lot of potatoes and stuff, your bowel movements are likely to be firm, and then that's going to cause you to contract your ab muscles a lot more. So you want to like eliminate that and you want to maybe go for like light leafy greens, carrots, maybe like little like roasted carrots, like the soft ones. Like you want to stay close to softer like vegetables and foods, except for the starch, because starch can like block up. So you may want to stay away from that. Advice: water, water, water. I'm gonna say it again: water, water, water. Make sure that you have lots of water. I did not drink enough water, and that was my biggest mistake, because like I was feeling nauseous every now and then. Um, and I was sticking with my ginger ale. That's another thing I'll get into. But yeah, definitely drink a lot of water. It's going to save you in the long run. It's going to make you feel better, and it helps you to heal a lot better as well. Um, this is the thing I wish I would have bought: Miralax. I have never in my life been constipated, and because I wasn't drinking enough water, and because I wasn't eating enough like the leafier greens and things of that sort, I unfortunately got constipated. And I literally was like, is this what people go through? Because I didn't even know what it was. I had to, talk to my doctor. And thankfully, the night before is when it happened, so I could go to the doctor and talk to her about it. She was like, "Yeah, I think you're backed up. Like you need to get some Miralax." And I'm like, "Oh wow, like that is the worst possible pain I've ever felt in my life." Like I was literally like in the bathroom. I want to say till like almost like 4 o'clock in the morning. I'm sorry if this is very unattractive, but we're here talking about endometriosis, and a lot of the things that come with it are not pretty. So I definitely say like after laparoscopy or laparoscopy, make sure that you get some Miralax. I got the little packets that you could put in the 8-ounce glass of water, and I stirred it around, and yeah, it helps. It really does help. Loose fitting clothing. As much as you want to look cute, it's not pretty. It's not gonna be pretty. I definitely also recommend getting your hair done like maybe like a couple days before or a week before, so you don't have to deal with it. Because I definitely didn't want to deal with my hair. I literally put Senegalese twists in my hair because I was like, nah, I'm not doing it for like 2 weeks. I know I'm not gonna want to. And literally, the only place or field trip that I went on was to the bathroom. It was the worst time of my life. I could not go anywhere. I could not do anything. And my boyfriend was trying to prevent me from being hard headed. So, yes. Um, so, loose fitting clothing definitely is going to be your best friend, especially with the incisions that you have. Um, with the, what is I going to say? With the cramps that you're going to have, because you will have some cramps. And then on top of that, it's just easy to take off and put on. And it's not constricting blood flow, because you definitely need the blood to be flowing in and out your body for faster healing time. Um, Definitely much easier. Um, the thing I also wish I would have brought with me, like during the day of my surgery, was a pillow. Uh, because my my boyfriend drives a low car, and I had to sit in the car, and you can kind of feel the bumps and the bruises and stuff. And over by this gas station that we went to, there was like a pothole, and he didn't see it, and it was like, and I was like, it was so bad. It was so bad. I'm sorry if you guys are chatting, because I cannot like, it's not letting me see it. It says live chat, all messages are visible. Okay, so I guess it's set correctly, but yes, he I wish I had a pillow to sit on. So definitely like get you like a little like butt pillow or pillow in general to sit on, cuz you going to feel it afterwards. you are going to feel it. And I'll get into how I felt after the surgery. Um, Heating pad. I always keep that on deck. That's something that you should have, especially like, I don't know about you guys, but like during my periods, or like especially like after the surgery, my lower back was killing me, like killing me. Like it caused me to have a hard time sleeping. So I would literally fold the heating pad around my waist, like on my back, and I would sleep that way. Probably a bad way to sleep, but that heating pad definitely helped me have some easier nights. So definitely get you one of those. Um, Small cups of diluted coffee. And diluted, I mean like you got this much coffee to this much water. That's what I mean. So when I was constipated, during like after my surgery, I literally I had to come up with something quick because I was like, this gotta stop. Because when I tell you that pain was something else, it was different. It was differently different. But I literally got up in the middle of the night. I went to my Nespresso maker. I put this much coffee in a cup, and I put this much water in the cup, like hot water, and then I like doused it. Like I drank it, like I took it like a shot. And when I tell you that was the best decision I've ever made, it worked. So definitely get you like a little bit of coffee to a lot of water. Like if you're not really wanting to take the Miralax, definitely go for that because that'll work. Um, Ginger ale. I am not a Verner's person as much as Detroit and everything that I am. I'm not a Verner's person. Verner's reminds me of when I'm sick. Um, because my mom, she used to heat it up and give it to us when we would like be really, really sick. I hate it. It tastes disgusting to me. So I am a Schweppes or a Canada Dry girl. So I got a couple of cans of like Canada Dry before my surgery. Um, and that actually like eased my stomach because like I found myself being nauseous quite a bit after this surgery, even immediately after I woke up. um I hate being nauseous. I don't know anybody that likes being nauseous. It will ruin my day. I hate it. um yeah. So definitely get you some Canada Dry or ginger ale of your choice, whatever the case may be. Just be aware of the sugar content. So that was the thing that I wasn't aware of. I was like drinking these cans of like Canada Dry, and I thought I was gonna gain weight afterwards, but I didn't. I didn't gain weight like at all, like after my surgery. So actually, it fluctuated like 2 pounds. Now that I think about it, it was like up and down 2 pounds, and I think it was mainly because of the sugar and stuff. But I was eating pretty decent. Um, but yeah, so you can dilute it as well, is what I would say. Like maybe like do like this much, like Canada Dry or whatever you prefer, to this much water. Almost like baby it. You know how you give a kid like some juice and then you put like water in there? I would definitely say do that. But don't drink too much. Don't be like me. This is what this video is for. I'm literally telling you the things that I did that I should not have done. Um, then saltines. Saltine crackers were my best friend immediately after surgery because like I was getting so, like how I said, I was so nauseous. Like it was insane. Insane. And then obviously the medication that the doctor's office gives you, I definitely say like if they prescribe you hydrocodone, be very careful. I had a bad experience with hydrocodone. I was sweating. I was having these weird dreams. It was a whole freaking thing. So like as soon as you get off the hydrocodone, the faster I would say you start healing, cuz a lot of that medication it causes you to slow up on your healing as well. So ibuprofen, cool, Zofran, cool. Um Hydrocodone, I don't know, man. It, that was not for me. Like Julian had to take me to the bedroom. That's how bad it was. Like I couldn't walk really. Like it was bad. Um, so that's pretty much like my before surgery shopping list, kind of. But uh, for my endometriosis symptoms, like what made me go to the doctor, what made me question what was going on and stuff. I had bad periods since I was like 13 years old. So and some of it would go from regular to heavy. There would be times to where my mom would get a call from like my teacher and she would have to come and get me, or I unfortunately bled through my pants, like right through the pad or whatever it was that I had, and I had to go home. And I would literally like immediately when something's wrong with my body, usually I get a fever. So like I would get a fever. There was a lot of different things that were happening to me at a very early age that kind of like indicated to me that something was not right. Um, and then my first gynecological visit, they told me that I had dysmenorrhea, which is technically just like a different term for really bad periods. And I honestly think that we need to get rid of that term and just go into like, something's not right here, because I feel like I feel like dysmenorrhea is an excuse to shove off endometriosis or anything else that could possibly be going wrong. And that's just my opinion. But I don't know what anybody else thinks about that. Um, but yeah, like it, it is what it is. I have no idea. But then when as I got older, things kind of started to change. Um, my periods got a little bit easier, but also it was still something that like I was dreading, and it started getting heavier, start clotting more. Um, and then I just started to recognize that usually the week of my period I could not function. Like I would literally have to stop what I'm doing and sit in a bathtub of hot water um for like an hour or two, and that's not really good for your body, is sitting in like hot water for that long. But heating pad, obviously. I'm not a person that likes to take medication, so I actually was relying on ibuprofen for a while, which I hated. And then let me see, I used to do Calmex, where you put the little powder in the water and it's supposed to like, it's got magnesium in it, so it's supposed to eliminate like body cramps and stuff like that. I did so many things like to try and alleviate the pain. It's almost debilitating. Like it's even like hard to do like everyday tasks when you have endometriosis and like bad period pains and things of that sort. So you can only imagine what I'm going through. And on top of that, having a hydroxyl pinks. So going into the day of the surgery, I got in there at like 7 a.m. or something like that. And they got me all prepped and everything. Um, I was really nervous. I was really going through it. I'm really thankful to have a partner that actually like was in my headspace, and he was trying to help. I was being like a little bit, you know, angry towards him and stuff, and I had apologized to him for it, because I'm sitting here and I'm just like, like it's not your fault. Like I just was feeling something, and sometimes you take things out on the person that you really care about. It's a sad fact, but sometimes that's what naturally happens with people. Um, but I broke down in the room. I was crying. Um, and the doctors came in to ask me, different questions. Like, I think they wanted to make sure that I was aware of what was going on and what was supposed to be happening and keeping me calm and stuff like that. And then they came in to come and get me for the surgery. And the lady asked me how I was feeling. I was like, I feel kind of nervous. Like, I haven't had an internal type of surgery before. I've only had a surgery on my wrist when I dislocated it. And she was like, that's okay. She was like, I'm just waiting for the rest of the surgical team to come in, and then I'm going to give you a little cocktail in your IV. And I said, oh, okay. So they told me to kiss Julian goodbye, told me to give him my glasses and stuff. And They put the little cap and stuff on me, and they rolled me out. And the lady she was like, "All right, I'm just, giving you the cocktail and stuff." And as they're rolling me to surgery, the hallway gets narrow. So, your girl was high. And then, like, I think they were laughing at me because I think they knew I was high, but I remember saying something along the lines of, like, "I'm just so glad y'all are nice. Y'all are just so nice." Like, it's just like, what is going on? But I just remember these metal doors opening, and then they had this surgical chair. It wasn't like a table, it was like a chair. Like, they could prop me up if they needed to, and it had little stirrups and stuff on there. And, but they had me scooch over. The lady was just like rubbing my hair, and I just remember, open, and I just remember the lady was like, "Oh, there she is." She's like, "We thought we almost like lost you there or something." I'm like, "Wait, what?" Like, but apparently my blood pressure had dropped like really, really low or something, and I was like pale or something like that. And she just wanted to make sure I was okay. She said I had like a little bit of sleep apnea, which I guess I don't know that. I had no idea. Um, and she asked me how I was feeling, and I said I feel nauseous. Like, that was the very first thing that I felt. And then I told her, I said, it feels like somebody, like, it feels like I did like 1,000 crunches, and like somebody like punched me in my torso. She was like, "That's actually like a perfect description of probably how you feel right now." And I'm like, that's what it feels. I was like, it feels like I worked out and didn't take a break, like, at all. Like, it literally felt like that. It felt like my body like hurt, like, especially my torso. Um, but that nauseousness, like, I feel like I could deal with the cramping, and I could deal with the pain of the torso thing. But like, when I tell you that nauseousness hit me like no other, it was so bad. Um, but yeah, like, and then immediately afterwards, the lady had to help me out of bed. She told me not to look at the bed because of, the blood that was probably on the bed. When I got out of the bed, she technically caught me because, like, it felt like I had to learn to walk again. It was very weird. Um, and she had to help me put my clothes on. So did Julian. And it was different. Like, and they had me sitting in the recovery room chair. Like, they moved me from the bed area to the chair area. And then Julian, when we were alone, he goes and says, "So I saw the pictures." And I was like, "There's pictures? Like, what?" And he said they had to get another doctor involved because there was something they never saw. And I'm like, "What?" And he said, "So not only did you have like endometriosis, which I saw in the picture. I'm not gonna show you guys a picture because I could get banned, but a picture had endometriosis. It was clear, but I had a white mass in there, and come to find out, it's non-cancerous. They did their little testing and stuff on there. It's actually like a wrapped piece of like fat that had endometriosis, and it died off, so it turned white. Very weird. They said they've never seen it in their 20 years of working. um then I had a torsion happening with my ovary, so it was very difficult to see. And then also I had like cysts in different areas that they saw. So the doctors were pretty much saying, like, I don't know how she was walking around like that. I don't know how I was walking around like that. Maybe I have a high tolerance, or I just deal with things or whatever, but I have no idea. Um, so there was that. Um, and Julian's like, Who's the other doctor?" He was, oh my God, he was so pissed. He was mad because he was like, "Why are you walking around like this? Like, why hasn't anybody seen anything?" And I'm like, I don't get it either, because like, if it only took Dr. Jones to do like a, pap smear and like an ultrasound, like, if it's that easy to figure out, why didn't any doctor do anything about it? So they had to have another doctor come in during my surgery to make the call to stop the surgery, because like they wanted to make sure I didn't have cancer, because they saw those little white things. But he said that it's not just one, there's like different ones everywhere, so they think it's a different form of endometriosis. um so yeah, like it's crazy like how this has come about. But he said like now that I don't have it, and he knows that I don't have like cancer or anything, like now he wants to proceed further. um so recovery time, obviously I had to stay in bed practically for like 2 weeks. The only place I went to was the bathroom, and need help with that, and taking showers and things like that. um but yeah, like, so the after surgery complications, the main thing is that you obviously like have to be careful with, the showering, how you stand in the shower, like making sure that your wounds don't get wet. So it's very helpful to have a partner there to help you throughout the surgery, because like you're gonna be in like a lot of like after surgery pain. My pain wasn't as bad as I thought it was going to be. I genuinely thought like I was not gonna be like I thought I was gonna go insane with how bad of pain I thought I was gonna be in, but I'm not, or I didn't. um the constipation could be an issue, like if you don't drink enough water, if you don't like get like enough like leafy greens or like fibrous vegetables in your diet. Like I said, stay away from the potatoes, and be light with the broccoli, but definitely make sure that you are still getting some fiber of some sort. um and then um obviously, what was I gonna say? They said that I can't like, they said I can't do like rigorous activity, like, like exercising, things of that nature, no sexual activity. um Definitely can't do that. And y'all know I love to work out, so like the fact that I couldn't do my Pilates and stuff, that hurt me. um, but I had to be cleared by my doctor, and I'm still not cleared as of yet, and I'll get into that in a minute. um and then what was I gonna say? You obviously bleed on and off, like after your surgery. I wanted to say like my body kind of tricked me into thinking my period came immediately, like a week after I had my surgery. It's not. It's just post surgical bleeding, and it's your body's way of trying to get back in the rhythm of things. So don't get too confused with that. And the pain with that period is probably going to be, or that after surgical bleeding is going to be the worst that you have. So brace yourself. It's different. Um Also, I do want to discuss uh briefly, because I want to be on here for an hour. I don't want to be on here for too long or taking up too much of you guys this time, because I know it's Memorial Day. um Being in a relationship and having endo, or having a family member or loved one that does have endo, is hard. It is definitely hard on the other person. I try and keep in mind that my partner does not understand what I'm going through, and he doesn't really like, he can't feel what I'm feeling. So like describing anything to anybody that's never been through it is very difficult for them to grasp or get a hold on. So you have to be very patient with them. As much, as you're going through, you have to kind of be considerate to the fact of, they don't know, they have no idea like what type of pain that you're going through. Like it took for me to have the surgery and for my doctors to explain like how, like why like she was walking around like this is crazy to them, for him to understand like, damn, like this is a real thing. Like it's not like he wasn't sweet before, like he understood, like, like I was in pain, because nobody just curls up on the bed and is like, like making noises and stuff like that. Like no, like it's more to it than that. He knows what I'm going through. And but I think like now, because like he actually got it from a not just a medical professional standpoint, but like also there was like a lot of women like in the room, like because like they get it, like and they kind of explained it to him, like, this is what she's feeling right now, like, and he's like, oh my God, like, this is real, like, this is really, really happening. Like, I think now he has a newfound appreciation for me and what I was dealing with, and is here. He was here before, but like, he's here to help me even more so, with the understanding that I was in a lot of pain, and that this is something that's, like, kind of interfering with my life and my everyday activity. So being in a relationship, or having a loved one, or a family member that's going through endometriosis, just be there. Like, that's the biggest thing that I can say. Like, just you don't even have to say anything. Just give them a hug. Like, it's it's difficult as it is, like, with all of our thoughts that we have accumulating in our head, like, in regards to, like, I know me, like, the having children part kind of bothers me, um because in my head I'm like, I shouldn't feel rushed to have kids. Like, I don't want to have kids right now. I want to be the traveling auntie. That's how I feel right now. But um that there's people to where they're just like, I just want to be out of pain. Like, I definitely want to be out of pain, but they just need somebody to love on. They need somebody that is going to be there for them, like, no matter what. Like, um somebody that's going to take that ride with them. And if you're not that person, that's okay, but like, don't ever like say like, oh my God, all they do is complain, and all they do is you have no idea. Like, you genuinely have no idea what we as people that have endometriosis are going through. It's insane. That's why I now that I'm going through, I can't believe what my sister and my mom were going through. Like, I can't, like, this is hard. This is difficult. Um, but it can definitely take tolls on your relationship. But like, if you work through it, and if you talk through things, and I'm just speaking on my own relationship, like, if you talk about it, and you guys take the time out to listen to each other, and you want to make things, work, like, it's gonna take a lot of compassion and understanding, and having those difficult conversations is very important. But yeah, it can definitely take a toll. So like, be patient with each other. Try to get them to understand what you're going through, and not out of anger. Like, be open and honest, and I would just say, like, patient. Patience is like key. I know I keep saying that, but patience is like a big one, like, because they really don't understand. And if you aren't taught, and if you don't understand what's going on, then you just don't, you're not going to know. You're not going to know. So I do have to get another surgery, and this one is a laparotomy, but because now they know that I don't have cancer, thank God. Um, they want to do a laparotomy, so technically this is going to be a more, um, is the word intensive type of surgery. So I'm going to have like almost like a cesarean cut across my waistline, and they're gonna go in, and they're going to be extracting things. So they're gonna be like trying to get rid of like some of um, those little white things I told you about, the endo. They're also going to drain some cysts that I have, and they're also going to see if it's a possibility that I can get pregnant, because I do want to know. I also have to have the other doctor involved, because um, apparently my intestines are stuck to my uterus, so he has to pretty much like get rid of that scar tissue that's in between, and lift it up, so that way my other doctor, my gynecologist, can see what's going on. So for this surgery, I do have to stay in the hospital overnight. I have to be there, and I have to be monitored, because like, I guess this is a more, is it invasive or intensive? I feel like I'm mixing up the words, but I think it's a more invasive type of surgery. Um, so I'm gonna see what happens, and we're just gonna pray that everything goes well. And I really pray that this is the step to a better life, and my boyfriend kind of reassured me. He's like, you know, like you could have figured all this out by the time you were like 45, 50 years old and you wouldn't have even like known. So he's like, the fact that you found it out now and you have like these great doctors that are going to like, you know, tell you or that have told you what the issue is and are willing to help you like right now is incredible, because like not a lot of women like go through this. And I know that for a fact because my mom, like for example, like she didn't know for like years. um so I'm very thankful for my doctors and stuff. I know that they don't really watch my YouTube videos as far as I know, but I just want to say thank you like for answering all my questions, for being there for me, for being there for other women, because I'm sure that both of y'all have like changed other women's lives and stuff. Um I'm just super super thankful, and you know like I pray that God continues to bless y'all like with everything, cuz like I couldn't ask for a better like dream team, because they're just so great. They're great people. Um, thank you. We need more doctors like that. Like seriously. Um, how I'm feeling right now is I'm feeling pretty good. Um, but there's still like little things here and there, obviously with endo, like because it doesn't immediately like it doesn't go away. You just find better ways of managing it, and I still have like little difficult like periods and stuff like that, but I'm hoping after this surgery that it gets better, or I can find a better way to manage it where I can actually live an active lifestyle like I'm used to. Um but for the last like 10 minutes of the chat, like I did want to, I know that there's, it doesn't look like there's been people popping in and out of here, but like I don't see many people like talking or asking questions. So I'm going to leave it open for the next couple of minutes for you guys to ask questions if you do have any type of questions. And then I'll be putting this up later too. So like if you have questions later, um, I'll be able to see those and I'll be able to answer those for you guys. But I really want to thank y'all for watching this. Like whoever did watch this, I didn't see anything pop up. This is my first YouTube video. That's okay. This is cool. And some people, it's Memorial Day. So, like, if you live in the United States, it is Memorial Day. So, some people are just out grilling and chilling. Um, so, that is okay. But I did hope, or I do hope that this helped a lot of you guys that are going through endometriosis, have family members and friends that could be, you know, experiencing this, or, you know, just starting their journey with this, unfortunately. um and how to better like manage it, how to prep for the surgery and stuff, my experience personally with it. um and while I'm talking, don't be afraid to ask questions because I'll see it pop up. But I really do hope that this helped you guys. I hope that, you know, you get the help that you need. um Definitely finding the best doctor for you is crucial. um Definitely ask around in your, whether it be your family circle, your friend circle. You never know, because people know people, and that's technically how I found the doctor that I have. And sometimes it's not that easy, but definitely ask, like, because like there are certain doctors that will not look into this because apparently it's that difficult. That's not an excuse, but that's what one of my doctors have explained. They said they just kind of blow you off, didn't they? And I'm like, yeah, like, and he's like, that's not uncommon, unfortunately. And I'm like, so yeah, like, but if you guys did have any further questions, don't hesitate to ask me here. If you want to message me on Instagram, you guys can go and follow me on Instagram. That's N0ELLEON. I'll try and see if I can put it in the description below. I'll keep my DMs open and stuff, so I'll get your messages and I'll answer them if you want. I'm not an expert on endometriosis, but this is what I'm going through step by step. And I didn't think that my channel was going to go in this direction, but God puts us on a certain path for a reason, you know. And um oh, before I go, because I literally, I wanted to share with you guys some things that like helped me during my time of like solitude because like I was literally in bed for like 2 weeks. Um, one of the biggest things, like not only was watching like, was it, I think it's the still watching Netflix thing with Trixie and Katya when they go over the Netflix shows. I was literally obsessed with that. I was watching that so much. But I did this is soul therapy, and it has certain activities each day. This is not sponsored, by the way, but literally it'll ask you like questions and stuff, and it really gets into your head with what you're thinking. um and it makes you like, aware of your thoughts and aware of your emotions, things that you're feeling at the time. And sometimes like it also like helps you to be sure of yourself, because like I have a hard time deciding things. I have a hard time in deciding things. um so it really helps me to be aware with what I'm actually thinking, what I actually want, what I actually need, and stuff. Like it's very therapeutic. So definitely check that out. It's called Soul Therapy, and it's a 365-day journal for self-exploration, healing, and reflection. And it's by Jacqueline Cadman. Cadmian. I think that's how you say that. I'll try and see if I can link that below as well. Um, but that really helped me sleep. Sleep is gonna be a big one. You're gonna miss chunks of time, but like, because there was times where I woke up and I'm like, where am I? What am I doing? Like, what day is it? Like, but you're gonna need a lot of sleep. Um, Talking on the phone to people, visitors help. Um, yeah, like, but honestly, like as difficult of a time this is in my life, I feel like it's necessary to my growth. And sometimes you gotta think about like certain things happen for a reason, and is sometimes these things like are conducive to your growth. Like is negative as the situation may seem in the moment, it's gonna be positive for your future. So, ooh, that was deep. I feel like that was deep for like no reason. But yeah, we've got like less than 3 minutes left. Let me know like if you guys have questions. Like I said, like if you don't have questions now, or if you just out grilling and chilling with family, or doing whatever it may be right now, this will be up later. So I will see your questions. I will be able to answer them. Just be patient with me because I may be out, who knows. Um, but I do thank y'all very much. I love all of y'all. Thank y'all for supporting me, and thank y'all for just being here for me through this up and down time. Let me know if you guys want to see more of these lives in the future. Um, if you guys like these, maybe I can do these like maybe like once a month, because I don't know if I can do this every week. um, we'll see. I don't know. But yeah, I hope y'all have a wonderful holiday. To all of y'all that are in the U.S., stay safe, eat lots of food, enjoy the sunshine, get your vitamin D, sending all the good vibes to everybody across the world. Um, but yeah, I'm gonna enjoy my coffee because I've literally been sitting here babysitting it. But we got one more minute. When you try to not make things awkward and then they just end up being awkward. Now this is really awkward, but that's okay. I'm weird. Embrace the weirdness. But yeah, I really do hope that y'all have a lovely day, and I hope this helps. Don't hesitate to talk to me. That is what I'm here for. Um, and if you want all the details, I'll give you all the details. If you don't want all the details, I'm gonna ask you too, for sure. I'm like, you want to hear the truth? Because I want you to be able to open the door. So, but yeah. But all right, guys, this is coming to a close. Like I said, send me your messages. I'm here. I hope all of you have a wonderful day, a happy holiday if you are in the US, and I will catch y'all in the next video. Bye. Bye, guys.